The United Nations has called for specific action for women on the front line in the fight against COVID-19. It urged governments to take action for women who make up about 70% of staff of health and social services, adding that the stress and mental burden they often face at home requires specific action.
We do need to make sure that we are paying special attention to their needs, such as ensuring personal protective equipment, conditions of work that do not tax them and their immune systems, as well as policy measures that ensure that women are included in decision making. If you turn on the TV and you look at who's talking about the pandemic, it's mostly men.
With 90 countries around the world on lockdown and about 4 billion people trapped in their homes, the United Nations has warned of increased violence against women. According to recent surveys, the number of assaults has increased by an average of 30% in France, Argentina and Singapore.
I urge all governments to make the prevention and redress of violence against women a key part of their national response plans for COVID-19. That means increasing investment in online services and civil society organizations, making sure judicial systems continue to prosecute abusers, setting up emergency warning systems in pharmacies and groceries, declaring shelters as essential services, and creating safe ways for women to seek support without alerting their abusers.
The United Nations stressed that the economic impacts of the coronavirus will affect women more violently, since most of them receive lower income and are less protected. Short and medium-term national responses could therefore include programs to ensure their economic resilience and improve their capacity to absorb future shock.
What we need right now, specifically, is for the EU to enable and to ensure that governments are able to invest in essential public services into the long run and are not having austerity imposed upon them. What we need is to make sure that in designing stimulus packages or investment injections, that those are built around the reality of people's lives and the reality of women's work. So we need to make sure that that gender perspective is brought into the design and rolling out of those investment and funding mechanisms as well.
Women in developing countries also have to give birth in difficult conditions. They have limited access to health services and family planning centers.